Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Pulmonary fibrosis. Introduction. Pulmonary fibrosis is a lung disease where the lungs develop scars, known as fibrosis. This scarring makes breathing difficult because it thickens and stiffens the lung tissues, hindering oxygen from easily entering the bloodstream. Every year, around 50,000 new cases of idiopathic pulmonary fibrosis, IPF, are identified. While men are more frequently diagnosed with IPF, the incidence in women has been increasing. This guide explains pulmonary fibrosis. It discusses its nature, causes, symptoms, and the processes involved in diagnosis and treatment. Causes and types. Pulmonary fibrosis is a group of lung conditions causing inflammation and scarring around the lung's tiny air sacs, known as alveoli. Inhaling hazardous chemicals can lead to pulmonary fibrosis. It can also stem from certain diseases, medications, or genetic factors. Smoking increases the risk of developing pulmonary fibrosis. In many cases, the exact cause remains unknown, and this is referred to as idiopathic pulmonary fibrosis, or IPF. There are over 200 types of pulmonary fibrosis, most of which have no known cause. The most common form of PF is idiopathic pulmonary fibrosis, or IPF, where the cause is unknown. About 50,000 new cases are diagnosed each year, mostly in people aged 50 to 70. It's more prevalent in men, but an increasing number of women are being diagnosed. Some cases result from autoimmune diseases like rheumatoid arthritis or Sjogren's syndrome. Viral infections and gastroesophageal reflux disease, GERD, are also risk factors. GERD, where stomach acid backs up into the throat, can cause lung damage if the acid is inhaled. Familial pulmonary fibrosis occurs when 2 or more family members have IPF or other similar lung diseases. Genetics plays a role, but much is still unknown. If your family has a history of lung disease, it's essential to discuss this with your doctor and a genetic counselor. Exposure to hazardous materials like asbestos or certain chemicals can cause pulmonary fibrosis. It can also result from inhaling bird or animal droppings, certain medications, and radiation treatments. Symptoms. Pulmonary fibrosis often goes misdiagnosed because its symptoms resemble those of other lung diseases. Most individuals with pulmonary fibrosis typically start showing signs when they are between 50 and 70 years old. Common symptoms include shortness of breath, particularly during exercise, a dry cough, fast and shallow breathing, unintended weight loss, tiredness, aching joints and muscles, and changes in the shape of fingers or toes. If you experience these symptoms, especially if you have a family history of lung disease or have been exposed to risk factors, it's crucial to consult a doctor and consider seeing a specialist for an accurate diagnosis.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Complications. Pulmonary fibrosis can worsen over time, but its progression varies significantly among individuals. The following section discusses potential complications. As pulmonary fibrosis progresses, it can lead to respiratory failure. This occurs when the lungs can no longer provide enough oxygen to the body or remove enough carbon dioxide, which can be life-threatening. Pulmonary fibrosis can cause increased blood pressure in the lungs, pulmonary hypertension. This condition puts strain on the heart and can lead to heart failure over time. The increased strain on the heart from conditions like pulmonary hypertension can lead to complications such as right-sided heart failure, where the right ventricle weakens or fails. People with pulmonary fibrosis are at a higher risk of developing lung infections, which can further damage lung tissue and exacerbate breathing difficulties. There is an increased risk of lung cancer in individuals with pulmonary fibrosis, possibly due to the chronic inflammatory and scarring processes in the lung tissue. In some cases, pulmonary fibrosis can lead to pneumothorax, where air leaks into the space between the lung and chest wall, causing the lung to collapse. This can be a severe complication requiring immediate medical attention. Patients with pulmonary fibrosis may experience acute exacerbations, where their symptoms suddenly worsen significantly. These episodes can be life-threatening and often require hospitalization. The chronic nature of pulmonary fibrosis and its impact on daily life can lead to emotional and psychological challenges, including anxiety, depression, and stress. Individuals with pulmonary fibrosis need to be closely monitored by their healthcare team for these complications. Early detection and management of these issues are crucial in improving the overall quality of life and outcomes for patients with pulmonary fibrosis. Pulmonary fibrosis can worsen over time, but it's impossible to predict the exact progression or lifespan for anyone with the disease, as it depends on various factors like age, overall health, lifestyle, and disease severity at diagnosis. Diagnosis. During an initial health check, your doctor will examine your lungs and gather detailed information about your health history, including family medical history and any exposures to hazardous materials. Various tests help determine lung function. Pulmonary function tests measure lung size and air movement. They often include using a spirometer to blow air as hard as possible. Pulse oximetry. A device placed on your finger measures blood oxygen levels. Exercise stress test. This involves exercising on equipment like a treadmill or bike while monitoring lung function. Arterial blood gas test. A blood sample from an artery measures oxygen and carbon dioxide levels. Imaging tests like chest X-rays and CT scans, particularly high-resolution computed tomography, HRCT scans, provide detailed lung images. These tests help in detecting scarring. Echocardiograms may also be used to check heart function and identify issues like pulmonary hypertension associated with pulmonary fibrosis. Sometimes a tissue sample is needed for a precise diagnosis. A bronchoscopy, where a tube is inserted into the lungs to collect cells or fluid, can do this. In more complex cases, a biopsy may be required. Additional tests might include an esophagogram to check for esophageal disorders and blood tests for other conditions, including tuberculosis, liver and kidney function, and joint disorders. Treatment. The treatment of pulmonary fibrosis focuses on managing symptoms, slowing the progression of the disease, and maintaining the quality of life. While there is currently no cure for PF, a combination of medication, lifestyle changes, and supportive therapies can significantly help patients. Medications like pirfenidone and nintedanib are used to slow the progression of PF. They work by reducing lung inflammation and fibrosis. In some cases, corticosteroids may be prescribed to reduce inflammation. Since acid reflux can worsen PF symptoms, medications to treat gastroesophageal reflux disease, GERD, are often recommended. For advanced PF, or when blood oxygen levels are low, supplemental oxygen may be prescribed to ease breathing and reduce strain on the heart. Pulmonary rehabilitation programs provide education and exercise training to improve lung function, reduce symptoms, and enhance the overall quality of life. These programs often include breathing exercises, physical exercises, nutritional advice, and emotional support. Maintaining a healthy lifestyle, including a proper diet, exercise, and lung protection, is crucial. Smoking cessation is vital, as smoking can exacerbate the progression of PF. A balanced diet rich in fruits, vegetables, lean protein, and whole grains can help maintain overall health. As recommended by a healthcare provider, engaging in light to moderate exercise can improve lung function and physical endurance. Regular follow-ups with a healthcare provider are essential to monitor the progression of PF and adjust treatments as necessary. In severe cases of PF, particularly in younger patients or those in otherwise good health, a lung transplant may be considered. This option depends on the individual's overall health, the disease's severity, and the availability of donor lungs. Psychological support, including counseling or support groups, can be beneficial in coping with the emotional challenges of living with a chronic disease. Palliative care may also be recommended to manage symptoms and improve the quality of life.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Final notes. Patients with pulmonary fibrosis need to work closely with their healthcare team to determine the best treatment approach based on their health status and the specifics of their condition. The evolving nature of pulmonary fibrosis treatment also underscores the importance of staying informed about new therapies. Advances in research continue to improve life expectancy and quality for those with pulmonary fibrosis. However, it's impossible to predict the exact progression or lifespan for anyone with the disease, as it depends on factors like age, overall health, lifestyle, and disease severity at diagnosis. Thank you for using Explain.